Good afternoon, everyone, and thank you for joining our daily briefing on the City of Philadelphia's response to COVID-19. Today, all speakers are joining the briefing virtually to adhere to social distancing guidelines. We will begin our briefing today with opening remarks from Mayor Jim Kenney. Mayor, you now have the floor.
Thank you very much, and good afternoon to everyone. I want to thank everyone who has been doing their part to stay home and help us stop the spread of this virus. We must continue being diligent because, as I've said before, we could see a surge in cases at any point. Despite some signs of progress, we are clearly not out of the woods. And as we prepare to resume construction activity tomorrow, and with additional commercial activity to resume as the city eventually reopens, we want to ensure people and businesses are taking the need for continued restrictions seriously. Yesterday, the Board of Health passed a regulation increasing the penalties for violations of these orders. For businesses, the penalty for a violation of the business operation orders or any other regulation concerning those orders is now $2,000 per violation. For individuals, the penalty for a violation of the orders is a fine of $500 per violation. Enforcement officers also have the discretion to issue code violation notices to allow payment of lesser amounts for violations of the orders to avoid being taken to court. The cost of these violations are $700 for violations subject to a $2,000 penalty and $250 for violations subject to a $500 penalty. Prior to these increased penalties, fines were a maximum of $300 per violation. Up until this point, we have done our best to rely on verbal warnings from police and notices from enforcement agencies. But the message should be clear. As we ease restrictions, we will need cooperation and for people to follow the orders. If you don't follow the orders, the city will fine you and will take you to court. This is in addition to imposing any other existing remedies, including stop work orders and revoking or suspending licenses of businesses that violate the city's orders. We thank everyone for their cooperation on this, and we continue to fight the spread of COVID-19 here in Philadelphia. Next, I want to remind residents that most city offices and operations will continue to be closed until further notice. We originally had today, April 30th, as the end to the closures. But as we have announced previously, these closures were extended until further notice. City employees and the public will be notified as the city begins identifying what city operations and offices will need to begin limited reopening. Many of our services continue to operate online or by phone, and operational departments are still providing essential services. Residents with questions on what is still in operation should visit our website at phila.gov or call 311 to have your questions answered. Finally, I want to remind everyone that now is not the time to start easing up on our social distancing and stay at home measures. We know it's hard, but we all have to keep it up. The weather is getting nicer, but we all must do our part to stay home and stop this spread. Please stay home, wash your hands frequently, wear a mask, and stay at least 6 feet away from other people if you have to go out for essentials. And as far as the masks are concerned, I see a lot of people out there running without masks or walking without masks. Please put on a mask. It's not that much to ask, and you're taking care of all of your other residents and citizens and neighbors. Just wear a mask. It's not a big deal. Just put it on. Thanks. Now, Dr. Farley for his update.
Thank you. So today's April 30th, which means we've made it through the month of April. And may feel like every day is the same, but looking back on the epidemic, really a lot has changed since the virus first arrived here in early March. We went through a rapid growth phase in most of March and early April. Then through most of April, we went through a plateau phase where the number of cases every day was pretty similar. Now it looks like we're on the downslope. And all of us, particularly me, want the daily numbers to fall faster than they are. But the fact that they're falling at all is a sign that we're making real progress. So I'm looking forward to making even more progress in the month of May. But for us to do that, we need to continue doing what the mayor just said, and that is stay away from other people and wear a mask if you have to be around other people. So here are more details. Today we know of 665 additional cases with confirmed coronavirus infection in Philadelphia residents, bringing us to a total of 14,468 since the beginning of the epidemic. Now that 665 number is high. Many of this reflect previously reported cases, which were known by the state health department, but now have been identified as Philadelphia residents, so that we're counting them in on our numbers. It's still looking like we're past the peak of the daily count for Philadelphia, but the decline, as I said, is very slow. If you want to really understand the shape of this epidemic, look at on our website for the graph to see the trends. We're continuing to see clusters in congregate settings where people live together. Our cluster of infections in the jail now has 65 inmates who are testing positive. That includes 2 new positives since yesterday and 5 others who have recovered and been removed from isolation. Today, I have to report, sadly, of 66 new confirmed deaths from the coronavirus infection in Philadelphia residents, bringing us to a total of 607 since the beginning of the epidemic. Now, as with the cases, many of this now reflects identification of previous cases of people who died in the past in the state health database, which we now know are Philadelphia residents. It means that our peak of our graph of the number of daily deaths is higher than what we had before, but the trends in terms of number of deaths per day appears to be declining, and that's a good sign overall in the epidemic. Again, if you want to understand the trends, look at the graph on our website. Of those 607 total deaths, 340, or 56%, were nursing home residents. So this epidemic continues to particularly hit nursing homes hard. Our hospitals are looking about the same today. We have 964 people with this coronavirus infection in Philadelphia hospitals, 1,773 in hospitals in the entire Philadelphia metropolitan area. That number is down slightly from yesterday. And overall, it's about level for the last 7 days, after a lot of days of increases before then. Our hospitals are busy, but they're able to manage those number of patients. Our testing is available at an increasing number of sites across the city. We added sites yesterday. There's so many, I can't really summarize them here, but again, I want to just direct you to our website, phila.gov/COVID, where you can see all the different sites, links and phone numbers, and also information about what schedules are available. To remind everybody, don't catch this virus and don't spread this virus, which means pretty simple. Keep your distance. When you are out of the home, when you're around people, wear a mask. Now, before I finish out, I do just want to raise a different topic. I want to remind parents about the need to immunize their children, even in the middle of this epidemic. With the COVID epidemic, some clinics reduced their operations, and some parents stopped bringing their children to the clinics to get vaccinated, which means their overall immunization coverage is down. We're particularly concerned about measles. Our database is telling us that about 37% of children between the ages of 12 and 18 months don't have the measles vaccine. Before the epidemic, that was maybe 22%. We certainly don't want to have a measles outbreak on top of our coronavirus outbreak. Many of those clinics and doctors are open. Those that are not open, we are going to be encouraging them to open. And procedures are in place to protect you as a parent and your children from getting a coronavirus infection if you go to the clinic. So this is a perfect time for you to bring those children in, particularly the younger children under the age of 2 that don't have their primary series of immunizations completed. You want to prevent them from getting measles, which for them is going to be a far more serious infection than coronavirus. Thanks very much.
Okay, thank you, Dr. Farley. We are now going to move to Armando, who's going to give a Spanish language translation of both the mayor and Dr. Farley's remarks. Armando.
Mensaje del alcalde Jim Kenney para el jueves 30 de abril de 2020. Buenas tardes a todos. Quiero agradecerles a todos los que han estado poniendo de su parte, quedándose en casa para ayudarnos a detener la propagación de este virus. Debemos continuar siendo diligentes, porque como he dicho antes, podríamos ver un repunte de los casos en cualquier momento. Y a pesar de algunas señales de mejora, claramente aún no estamos fuera de peligro. Y mientras nos preparamos para reanudar la actividad de construcción mañana y la actividad comercial adicional que se irá reanudando a medida que la ciudad reabra, queremos asegurarnos que las personas y las empresas tomen en serio la necesidad de continuar observando las restricciones. Ayer, la Junta de Salud aprobó un reglamento que aumenta las sanciones por incumplimiento de estas órdenes. Para las empresas, la multa por una infracción en las regulaciones de operación comercial o de cualquier otra regulación relacionada con estas órdenes es ahora de $2,000 por infracción. Para las personas, la multa por incumplir estas órdenes es de $500 por infracción. Los funcionarios encargados de hacer cumplir la ley también están facultados para emitir avisos de infracción o Code Violation Notices y permitir el pago de cantidades menores por incumplimiento de las órdenes, para evitar así arrastrar a las personas y a los dueños de los negocios a los tribunales. Antes de este aumento, las multas tenían un máximo de $300 por infracción. Ahora, el costo de estas infracciones es de $700 por infracción, sujetas a una multa de $2,000, y las infracciones de $250 ahora quedan sujetas a una multa de $500. Hasta ahora hemos hecho todo lo posible para confiar en que eran suficientes las advertencias verbales de la policía y los avisos de los organismos encargados de hacer cumplir esta ley. Pero el mensaje debe ser claro, ya que para atenuar las restricciones vamos a necesitar la cooperación del público y que la gente cumpla con estas órdenes. Si no cumplen las órdenes, la ciudad lo multará y lo llevará ante los tribunales. Esto se suma a la imposición de cualquier otra medida, incluida la revocación o suspensión de licencias de negocios que desobedezcan las órdenes de la ciudad. Les agradecemos a todos por su cooperación con esto, mientras continuamos luchando contra la propagación del COVID-19 aquí en Filadelfia. A continuación, quiero recordarles a los residentes que la mayoría de las oficinas y operaciones de la ciudad continuarán cerradas hasta nuevo aviso. Originalmente teníamos el día de hoy, el 30 de abril, como el fin del periodo de cierre temporal, pero como hemos anunciado ya anteriormente, estos cierres se han extendido hasta nuevo aviso. La ciudad les notificará a sus empleados y al público cuando la ciudad comience a identificar qué operaciones y qué oficinas volverán a operar con una reapertura limitada. Muchos de nuestros servicios continúan funcionando en línea o por teléfono y los departamentos operativos aún están brindando servicios esenciales. Los residentes con preguntas sobre los servicios que están en funcionamiento deben visitar nuestro sitio web en fila.gov o llamar al 311. Finalmente, quiero recordarles a todos que este no es el momento de comenzar a relajar el distanciamiento social. Debemos permanecer en casa. Sabemos que es difícil, pero todos tenemos que continuar haciéndolo. El clima está mejorando, pero todos debemos hacer nuestra parte para quedarnos en casa y así detener la propagación de este virus. Por favor, quédese en casa, lávese las manos con frecuencia, use una máscara y conserve al menos 6 pies de distancia de otras personas si tiene que salir para lo esencial. Solo juntos podremos superar esta pandemia. Y esta es la actualización en materia de salud al jueves 30 de abril del 2020. Desde ayer se han confirmado 665 nuevos casos del coronavirus en Filadelfia y actualmente tenemos un total de 14,468 casos en la ciudad. Muchas de estas personas no tenían lugar de residencia identificado y se determinó luego que pertenecían a Filadelfia. Las tendencias pueden revisarse en el sitio web fila.gov/COVID-19. Tenemos 2 casos positivos de la COVID-19 entre los reclusos, con un total de 65 casos registrados y 5 internos adicionales que ya se han recuperado satisfactoriamente. Pero tristemente, reportamos 66 nuevos fallecimientos en Filadelfia, con un total de 607 personas que han muerto por la COVID-19. 340 de estas muertes, o el 56%, se han dado en lugares de hogares de ancianos. Y cabe subrayar que este virus no discrimina por raza o por género. 964 personas han sido hospitalizadas en Filadelfia y 1,773 personas en la región sureste de Pensilvania. Las pruebas siguen disponibles y hay más centros donde se están administrando. Usted puede encontrar mayor información sobre estos centros en fila.gov/COVID-19, pestaña FAQ. Hay que asumir que todo el mundo a nuestro alrededor tiene el virus, incluyéndose a nosotros mismos. Si no tienes el virus, no lo contagias a nadie, pero por favor, mantén la distancia social y quédate en casa. Si debe usted salir a trabajar o al supermercado, le recomendamos mantener la distancia social de 6 pies, usar máscaras de tela en lugares públicos donde sea difícil cumplir con las medidas de distanciamiento social. Hay que lavarse las manos apenas llegue a casa. Quiero también aprovechar para recordarles nuevamente sobre la necesidad de vacunar a los niños contra el sarampión. Por el COVID-19, algunas clínicas han reducido sus horarios de atención y los padres no están llevando a sus niños al doctor para vacunarlos, y nos preocupa particularmente el sarampión. El 37% de los niños entre los 12 y 18 meses de edad no han sido vacunados y debemos prevenir un brote de sarampión. Muchas clínicas y consultorios pediátricos están abiertos. Hay protocolos para protegerlo a usted y proteger a sus niños del COVID-19 cuando visite el consultorio pediátrico. Hay que recordar que solo juntos podremos superar esta pandemia. Gracias.
Thank you so much, Armando. We are now going to move to the Q&A portion for the members of the media who are logged in today. Please remember, we do have limited time during these briefings, so only one representative from each media outlet is permitted to ask questions. We also ask that reporters please limit your questions to 3 or fewer. We will do a second round of questions if time permits. So for those logged in today, please use the raise your hand feature. It can be found under the participants list. We also ask if you are able to turn on your video to ask your question, that is preferable. And we will now unmute reporters one by one to ask your questions. First up is Pat Loeb of KYW. Pat?
Thanks, Kelly. Dr. Farley, I was astounded to see Los Angeles is offering to test anyone who wants it, including the young and fit and asymptomatic. Given your experience with trying to get tests, can you fathom how they're able to do this? And have you reached out to their health department for help kind of spreading the wealth?
We're trying to get more information on that. I believe they're using a different test, which is available in a laboratory in Los Angeles. And it's a test which may not require swabs, so it simplifies the process. I'm not clear yet on how comfortable I am about the accuracy of that test. There's a good health department there, so I have general confidence in what they're doing. So we're trying to learn as to whether that test would be appropriate here and if it can be done with transport to Los Angeles. So we're still investigating that. Also remember, Los Angeles is at a different stage of the epidemic than we are. They have been declining for longer than we have. We're still at a situation where we have many, many cases in the community that we know are out there. If we test more people, we know we will find more positives. But right now, our advice wouldn't change that much based upon that. So there may be a role for that in the future, but I'm not sure that it's there right now.
Okay. And whatever happened to the rapid test that Philadelphia was testing?
There are these machines that can do the rapid test to have a small throughput. There's only so many tests that can do per hour, per day. But there are a couple of these machines we put out at sites. We are doing a parallel testing between them and the traditional test to see how accurate they are. These are the machines made by Abbott. There's another company called Cepheid that has similar machines, which we are trying to get a hold of, but we don't have these machines yet. There has been a validation done by some hospitals around the country, and the validation looked pretty good. It looked like they were fairly accurate. So we'll learn more about the accuracy of both of these tests. And as more of these machines are available, we will try to put them in places where we can at least have some people get the results in a matter of minutes rather than having to wait for a day or many days.
Thank you.
Okay, thank you, Pat. We're now going to Sean Walsh of The Inquirer. Sean?
Thanks very much. Mayor Kenny, can you elaborate on what prompted the increase in the fines? Is it because that you guys are observing that people, after cooperating a lot at first, are perhaps, being more liberal with the social distancing rules?
Well, I think that's part of it, but the other part of it is operationalizing the beginning of the reopening. That we want to make sure that even though the governor and we've agreed that things like construction can get started, we want to set a real strict rule that people need to follow the rules that are the guidelines that are there. So the way we do that is to get people's attention. With money, it gets people's attention. Sad to say, it's not any other things that are strong, but we're just trying to reemphasize the need to follow the rules and keep everybody safe as we continue to evolving this reopening of the city.
Thanks. And also for the mayor, tomorrow, Councilperson Kendra Brooks is going to introduce an expansion of the paid sick leave law that would make all workers, including independent contractors and gig workers, eligible for sick leave during the health crisis, and it would provide 14 days of immediate paid sick leave. Do you support this?
I support the concept. I haven't seen the bill, so I have difficulty commenting on the specifics. I'd like to see where the money's coming from. There may be some opportunities to get some federal dollars to do things like that, along with rent assistance and mortgage assistance. But the city, as council will learn shortly, is substantially behind on our revenues and up in our expenses. And we just don't have, we cannot do things that should be done by the federal or state government.
I see. And to that end, with your budget address tomorrow, Is your approach going to be primarily focused on cutting costs to the city, or will there also be, new proposals for increasing revenue?
You will see 4 or 4:30 tomorrow.
All right, I had to try.
I know.
Okay, thank you, Sean. We're now going to go to Leila Jones of Billy Penn. Leila.
Hello. My first question is for the mayor. Are there any updates on Welcome America? I know you said there would be like a plan or some information available this week.
But we're having those conversations with the organizers and with the sponsors, and we'll probably have something next week.
Next week, okay. Also, with regard to those citations, do you, Mayor, or maybe Managing Director, know how many of the $100 citations were given out?
I don't know personally, Brian.
So I'm not going to have a straightforward answer as you would like, but I'm going to do my best to provide what we have done up to date. So since the business activity restrictions have gone into place, the health department has investigated received 758 complaints about businesses that were operating or restaurants that were operating inappropriately. They've issued 583 warnings, and while they haven't issued any fines, they have issued some cease operations. I don't have the numbers from L&I, but if you email the press office, they are working on getting those. And then from the police department, there were 25 code violation notices issued in March and April for failure to disperse. 12 of those were on the first day of the stay-at-home order, which I believe was the 23rd. But generally, we have found that warnings have been as effective as CVNs and have seen a large amount of compliance when they've issued those warnings. And I think the other caveat I would say is that because our CVNs are being issued under existing code provisions, specifically failure to disperse, it's hard for us to determine exactly what the circumstances are of those CVNs.
So I have one more question kind of along those lines. If not many have been given out to businesses or individuals, why does the city expect that increased violations would be maybe a better deterrent?
We're about to open up significant numbers of businesses, and want to certainly send a strong signal that should those businesses not operate appropriately, they're going to see significant fines. And we do have the enforcement mechanisms in place to certainly police construction sites, and want to make sure that that's clear.
Thank you.
Thank you, Leila. We're going to go to Martin Pratt of Philly YBN now. Martin.
Hi, thank you. 2 questions. First question is for work permits for youth, summer youth. While we may not be having young people work in traditional way, I am aware of a few programs that are providing work for internships for our young people virtually. One of the questions that consistently comes up in these meetings is, will we be able to get work permits for young people in time for summer jobs?
I'm not sure of the operation of the work permit process. And maybe it's something we need to get back to you on.
Okay, thank you.
Let's Brian,
Second,
have anything?
No, we're going to have to get back to you on that.
Okay, thank you. Second question, yesterday a survey went out from the city of Atlanta that asked the residents exactly what they felt about and what they were looking for the city to do when reopening. Is there any appetite in Philadelphia to send out a similar survey so we can kind of gauge what people are thinking and wanting to do? And probably, would be helpful to figure out business-wise what businesses are willing to do.
I mean, I assume the information from the survey would be helpful in some way. However, I would not want to survey folks to get a wish list of what they want, which would fly in the face of what maybe medical advice or scientific advice is telling us. And people more of an idea that they can do the things they want to do. And I mean, I haven't really thought about it, but is an interesting idea, and we can certainly kick it around.
Okay, thank you. That was it.
Thanks so much, Martin. We're going to go to Manuel Smith with CBS 3.
All right. Good afternoon, guys. We just have 2 questions today. Brian and the mayor, I know you guys really don't want to talk about anything about the budget, but there is a memo that's been circulating sent to city employees who are non-union saying to expect some salary cuts in exchange for some comp days as part of the plan. For the non-union employees, which I know would include police and firefighters, has there been a discussion or consideration on the table of comparable cuts to the increases that they're scheduled to get under their new contract come July, given new budget considerations?
No, I mean, these are the folks that we're dealing with, who are dealing with the frontline issues of this pandemic. They have come to work on a regular basis. Absenteeism is not a problem. They are facing this virus every day, similar to what doctors and nurses and hospital personnel are, and we felt that it was appropriate to pay them the modest increase because it was budgeted already and in past budget, and we think this is the right thing to do.
Thank you for that answer. My second question is more for Brian, kind of the lowball question of the day. Are you guys concerned about the weather today? Any particular city preparations for severe weather that's forecast for the area tonight that have already been done or under consideration?
And there's nothing specific around our preparations or the preparations that we would make under any normal circumstances, making sure that we have, we know where our low-lying areas are and where potential flooding could happen. We have crews ready to deal with downed trees. I have very few concerns about the preparedness of our staff to deal with severe weather like we'll see tonight.
Thanks, Brian.
Yep.
Okay. Thank you so much, Manny. We're going to go to Brian Ortiz now with the Temple update. Brian.
Hi, good morning. Or good afternoon. Well, time's getting to me. Just one question. If we begin a limited reopening and see a quick spike in cases, how quickly would everything close down again? How prepared are we for that?
Well, I think it would have to, and Brian and Doc can comment, but I think it would have to do with the severity of the uptick. And again, as we've done with everything in all our decision making, we talked to Dr. Farley and the medical community and scientific community and determine the trajectory of that increase and whether or not we have to go back and reduce things that we're starting to take apart.
Go ahead, Tom.
I'll just add that it may take a little bit of time for us to notice that we're seeing an increase in cases. But once we notice that, I think we can act quite quickly to reinstitute sort of closure steps we've instituted this time.
Okay. Thank you, Brian. We are going to go to, thanks, Claudia Lauer at the AP. Claudia.
Hey, how are you? I know this is kind of a offshoot question, but Dr. Farley, can you go back and talk about these, the measles vaccinations again? I think I'm misunderstanding the numbers and I want to be sure that I completely understand.
So we looked at children between the ages of 12 and 18 months. And that group, 37% of them now don't have measles vaccine. Now, not all of them ordinarily would have measles vaccine. Ordinarily, it's about 22%. But that shows that there is definitely a sharp increase in the percent of kids in that age group that are not getting vaccinated because of all the closure that we're talking about here. If enough of a percentage of children are not protected against measles, then we're vulnerable to a measles outbreak.
Okay, so it's specifically children who are between the ages of 12 and 18 months.
Yes. But, it's reflective of a larger issue that just parents are not bringing their kids to be immunized. There's also the risk of other vaccine preventable diseases like pertussis, which is whooping cough. And so it's time now for us to really remind parents that this is still an important thing. You can't put it off forever, and that they can go in and get their children vaccinated.
Got it. Thank you.
Thank you, Claudia. We're going to go to Jack Tomczyk with Metro.
Yes, this question is about with a lot of construction projects getting ready to resume tomorrow, what other sectors of the economy do you expect will be able to be safely reopened next? Like what's next in line?
I don't think we're ready to talk and about that yet, Jack. I think we are working with our regional partners to understand what would be the conditions where we would think about reopening other sectors of the economy. But certainly those things that don't require mass gatherings or large crowds. But we're gonna take this cautiously and one step at a time. But we're still a ways away from having a broader scale opening of the economy.
Okay, and this second question is for Dr. Farley. With the 66 deaths, is that the highest number that has been reported during these daily briefings?
I think it is the highest number reported as a daily count. That's why I was trying to emphasize it wasn't that 66 people died yesterday. This is picking up a lot of information, deaths on a number of people who died in the past that were in the state's database, not previously recognized as Philadelphia residents, now recognized as Philadelphia residents.
Okay, thank you. That's my questions.
Thank you, Jack. We are going to go to our second round of questions. Back to Pat Loeb.
Thanks. I forgot to ask, Dr. Farley, do you know how many tests per day or how many people per day are tested in the city of Philadelphia at all the various sites?
From the laboratories that report to us directly, we do have that count. So that may not be a complete count, but we do have, it's a pretty good count. And you can get it yourself by looking at our website. We post the negatives and we post the positives. You can add the two together, and that's the number of tests.
Okay, thanks.
Okay, thank you, Pat. Seeing no other questions at this time, that will conclude today's daily briefing, and we will be back tomorrow at 1 p.m. Thank you.